everyone. My name is Brandy, and today I would like to talk to you about two very important factors in women's health. That would be why you should do monthly breast self exam and why you should get a yearly screening to check for cervical cancer. I feel these two topics go hand in hand, so that's why I chose to talk to you about both of these today. Women, I urge you to stay on top of your health and get these tests and do these procedures. The first one I'm going to talk about would be breast health and why you should do a monthly breast self exam. Breast cancer is the leading cause of cancer deaths in women. To prevent breast cancer, it is advised that you do a monthly breast self exam. If you don't know how to do these, you can log on to the Susan G. Komen website and it explains detail how to do this. If you don't feel comfortable with this, you could go to your local doctor and ask them to show you. What I recommend with this is that you get set up with what's called a buddy check system. We actually have in our community a big advocate for this. It's called the Buddy Check 10 system. This is where you pair up with either a family member or a close friend, and you make a note on your calendar each month, and you remind that person to do their monthly exams. Sometimes we get so busy in life that we just simply forget to take care of ourselves. The Buddy Check system, I would recommend with that is that you do this in between your menstrual cycles, usually in the middle, day 10 to 12, somewhere through there. I suggest you do this in the middle because if you do this toward the end or the beginning, sometimes your breast can be a little bit lumpier due to hormonal changes, and sometimes this could make you think you've got a lump that's actually nothing. If you do find something in your monthly exam, I urge you to go get this checked by the doctor. Don't wait. If you get this checked sooner, you increase your risk for survival if that was cancer, and you also have more treatment options available. If you are over the age of 40, I also recommend that you get a mammogram. The CDC also recommends that starting at age 40, women should get mammograms every year. Sometimes sooner if you have a predisposing factor such as a high risk of breast cancer in your family. If you have breast cancer in your family, you have increased odds of getting the cancer yourself, unfortunately. So it's extremely important these women stay on top of their breast health. The mammogram takes pictures through an x-ray machine and is then read by a doctor that specializes in reading these called a radiologist. If something comes back abnormal on these, they can schedule you for further testing. If you do these yearly, you could possibly prevent yourself from getting breast cancer. The second topic I'd like to talk about today that I feel goes hand in hand with this would be why you should get a cervical cancer screening yearly. Women, I feel this is especially important because, especially in cervical cancer, things can be prevented if you just go for this test. Yes, the test is awkward, but wouldn't you rather sit through 5 minutes of awkwardness versus having cancer for the rest of your life and dying from it? If you feel awkward doing this to the point that you really don't think you can go, take your mom, take your sister, take a close relative with you. The exam is a little uncomfortable, but it should never be painful. When you go to the doctor to have this exam, you can also check for STDs, possible diseases, or issues that could prevent your fertility in the future. And most importantly, it checks for cervical cancer. Usually on the screening, they have it checks for an HPV virus. The HPV virus stands for the human papillomavirus. This usually presents itself through sexual intercourse, and it changes the cells that are on your cervix. When these cells are changed, this does something to us that increases our risk for cancer. So if this is found on your yearly exam, your doctor can take methods and precautions to help you prevent this and help this to turn it into cancer. If something does come back abnormal on your test, don't freak out. It might not necessarily be cancer. Sometimes changes on the cell prevent that aren't linked to the HPV virus. They can do methods that are not as invasive, doesn't involve being in the hospital for this, to help prevent, to help from causing future problems. With this, talking about the HPV, there's also a vaccine out there available for girls about ages 15 to 26, and it's usually covered on most insurance plans. If you don't have insurance and find yourself out of a job, go to your local health department. They have plenty of resources to point you in the directions to. Sometimes you can get these tests or procedures from little to no cost. So there's no reason to say no. We've got plenty of resources in the community. Take advantage of them. Girls, I strongly advise you to take care of yourself. Take these preventive measures into hand. Take knowledge of them. If you have questions, ask your doctor. Don't wait. You're the biggest advocate for your health. So that's all I have for today. Thank you for listening.